minutes each. Deputy by
I'm going to go first.
And then
that's okay. This increase in VAT on food supplements to 23% is really shocking for huge numbers of people who need and rely on food supplements and vitamins. And I think the government need to abandon this misguided plan, to put it simply. I'll just give you a very simple example, Minister. Tony is a cancer patient, a constituent of mine. He's a pensioner with a medical card. He spends all of his small income on keeping his house warm and feeding himself. His medication is covered by his medical card, but food supplements and vitamins recommended by his doctor for his health are not included in that scheme. He had radical surgery that mean that in order to keep his body functioning, he needs a whole range of vitamins and food supplements because his body can't absorb certain vitamins. Currently, these cost him €70 a month. He can't afford that. If the new VAT level is imposed, that will go up to €86. It means he won't be able to afford them at all. So, do you think that's acceptable? To put it simply, do you think that's acceptable? That somebody whose doctor has recommended these vitamins and food supplements as absolutely essential to keep somebody who is ill and suffering from cancer, to keep their body functioning, that they should have to pay at all or to see any increases in it? So I think you should abandon this, and indeed these things should be covered by the medical card.
Thanks, Lascana. Minister, it seems incongruous that you're proposing to put 23% on all vitamins, minerals, fish oils and food supplements. This move will have a profound effect on those who take vitamins as part of a health programme. It also will disproportionately affect older people. It will also have a profound effect on the many run health food shops who struggle to open because of this proposed hike. And a number of people contacted our office over the weekend that would take supplements and vitamins as part of their regime. And they stated that if this proposed VAT hike is implemented, they cannot sustain their amount of supplements and vitamins for their income they have. Not because of their fault, the condition has chosen them, but that will disproportionately affect them. So, Minister, I understand it's at your discretion to either implement this or not implement it. I think there's huge public opinion on this issue that if you implement this, this would be akin to putting a VAT on children's shoes in the 1980s, and we've seen how that ended up in the government of Fine Gael. So, Minister, I think you should have a serious rethink, and there is precedent. In 2014, there was a proposed VAT on herbal tea, and the Minister at that time absconded it. So you can do the same.
Thank you. Minister has 4 minutes.
Thank you, Lascan Corlin. The standard rate of VAT applies to food supplements. However, there is a revenue concession which allows a zero rate to be applied to certain types of food supplements, such as vitamins, minerals and fish oils. The practice of zero rating vitamins, minerals and fish oil food supplements has been applied since the introduction of VAT in November 1972, when the marketplace for food supplements was small and the concession meant that vitamins, minerals and fish oil supplements were treated the same as food for VAT purposes. Since the 1970s, there has been a significant growth in the number and complexity of food supplement products on the market, most of which are not covered by the zero rate concession, such as supplements containing botanicals and bioactive substances. While these new products apply at the standard rate VAT, The growing variety of products in the market led to diverging views between revenue and the industry over which food supplement should be at the zero rate versus the 23%. Revenue issued e-briefs in 2011 and in 2013 in an effort to clarify that only basic vitamins, minerals and fish oil would qualify for the zero rate, but disagreement on the applicable VAT rate and queries on specific products continued. The operation of the current concession has become problematic because of the efforts by some in the industry to exploit the concession to extend the zero rating beyond the scope permitted by revenue. Some businesses have challenged revenue guidance and revenue decisions on the VAT rating of products, giving rise to concerns about compliance within the industry and unfair competition between compliant and non-compliant businesses. The issue was raised during the debates on the recent finance bill. Deputies and senators looked for clarity for industry on the VAT treatment of food supplements and sought for the retention of the zero rate for certain categories of food supplements. At committee stage, the Minister agreed that he would ask his officials to address the matter in the context of the next tax strategy group, and also stated that he would not interfere in any decision made by Revenue on the matter in the interim. Revenue published new guidance on 27 December concerning the rate of VAT that applies to food supplements, announcing their intention to apply the 23% VAT rate to most food supplements with effect from the 1st of March 19. It should be noted that human oral medicines, including certain folic acid and other vitamin and mineral products licensed by the Health Products Regulatory Association, will continue to apply to zero rate of VAT. It is possible to retain these products at the zero rate because they qualify as oral medicines which are charged to VAT at the zero rate in Ireland under the historical derogation, the EU VAT law. Infant foods will also continue to be zero VAT rated. I understand the concerns of industry in relation to this matter. This is why, independent of this Revenue's decision on interpretation, the Minister agreed to put in place a process that will conclude in 2019 tax strategy group paper to examine some of the policy choices around the VAT treatment of food supplements.
Can you just get off the script for a minute, okay? I asked you a question about Tony, who's suffering from cancer. Currently, he's paying €32.95 a month for a probiotic, €10 for thiamine, €10 for magnesium, and €20 for VideoParliament. Recommended by his doctor, he needs these things for his health, okay? And he's paying €70 a month. He shouldn't be paying that at all. If this VAT change goes ahead, he will be paying €86. He absolutely cannot afford that. Now, what is your answer to that, Minister? Do you think Tony, who is ill, or other people, vulnerable, elderly, sick people, who need these things to maintain their health, should be paying for them at all? Because I think they should be covered by the medical card. But do you think it is in any way acceptable that the price of those things is going to go up and make them unaffordable? Things that their doctors are recommending in many cases for the maintenance of their health.
Deputy Kenny has 1 minute.
Thanks a lot, Conor. Minister, this kind of goes against what your government is trying to do about promoting good health. I mean, at the moment, if I go to buy fast food, the VAT on the fast food is 13.5%. But after the 1st of March, if you get your way, if I wanted to buy a bottle of cod liver oil, there'd be a 23% on it. So that doesn't make sense. Now, at the moment, Minister, you can gauge opinion in here. Sometimes this is a bubble. At the moment, there's a petition online, and it's been signed by 25,000 people in relation to this matter, asking for the proposed VAT to stop it. So it's 25,000 people, and I'm sure that will going to grow over the time. So, Minister, you have 4 weeks to think about it. You can use your discretion, as been done before, because this does not make sense whatsoever. This will have a disproportionate effect on millions of people that use vitamins, millions of people, and this will affect them. So I would probably take kind of guidance from what we've said today and review this decision.
Minister, 2 minutes to respond.
I just want to clarify. The Minister for Finance said during the committee stage, and you were there, Deputy Barrett, and he said that he wouldn't be interfering with the Revenue Commissioners. They are independent of the Department of Finance, and you know well that. The Revenue have decided to bring clarity to the matter. What the Minister committed to doing, which was more than fair and more than reasonable, was to have a proper analysis by the Tax Strategy Group in relation to the zero rating or the rating of VAT at 23%. And that's what he said he's going to do, and that's what when I sat down and went through the analysis with the officials, that's what we will do. And that was agreed at the time of the last budget. And you were there in the committee meeting, Deputy, and if you chose to accept the Minister's word on that stage, well, you should accept it here and now. That will be, well, you should have called a vote on it if you wanted to, but I don't believe you did at that stage. Now, I'm not going to comment on an individual case here on the floor at all. I don't think it's appropriate. But the one thing that I will say is, from my perspective and from the perspective of Minister Donoghue, that the food and supplementary sector will get a fair hearing. They'll get a fair hearing from the Department of Finance, and when it goes on the floor of this chamber, it'll be a matter for the floor of this chamber to decide what to do in the next budget. And you will have your opportunity at that stage. And the revenue commissioners are independent of this chamber, and they're independent of the Department of Finance, as well you know.